In October 1918, as the First World War was drawing to a close, a British hospital ship, the Cahir, sailed for the North Russian port of Archangel. The British, as part of an Allied force, were supporting the White Russians, the anti-communists, in the Russian Civil War. The ship departed from Cardiff in that month. Boarding were 14 nurses, including Bridget from Old Church Street, Cahir, who had in 1907 travelled to London to train as a nurse. In the course of the conflict, she tended wounded soldiers in London hospitals. One of those who boarded the ship with her was Helena Hartigan from Crean, County Limerick. Her relevance to us is that she kept a diary of her experiences in Archangel, presenting it to us in the form of an article entitled "To North Russia on the Hospital Ship Cahir." Thus, we can reasonably conclude her experiences would by and large be the experiences of Bridget Ryan. En route to Archangel, a journey that took 12 days, the sighting of a whale generated considerable excitement, as indeed did the sighting of the Northern Lights, described as that moving celestial curtain varying from deep purple to pink, yellow or green, was a beautiful sight. On arrival at Archangel, a place that took its name from a 12th century monastery of the Archangel Michael, the ship was moored to the quay, remaining there for 8 months, largely icebound. Of course, the role of a hospital ship and its medical staff was to tend to the wounded and sick of the conflict. Describing some of the experiences of the nurses, Hartigan writes, "Archangel was a couple of 100 miles from the fighting line. Transport difficulties were many, particularly the transport of sick, at different seasons requiring different methods of transport. With the severe frost, the whole scene changed. The river became frozen in a night. Snow fell. Within a week, trains and railway lines were laid on the now solid river, and sleighs drawn by ponies brought the merchandise across the river where previously the boats had been busy. Patients arrived by sleigh in what they themselves called coffins. Wrapped in fur-lined sleeping bags and halting for food and change of horses at medical aid posts, the men found the open sleigh, well padded with hay, fairly comfortable. In addition, the ship had many distinguished visitors of various nationalities, including the French ambassador and Sir Ernest Shackleton. The arrival of mail was a great event. We were sometimes 6 weeks without one. The mail came by dog sleigh across the White Sea." Prior to departing for Archangel from Cardiff, the women had been issued similar clothing to the men to endure the cold: leather jerkins, windproof linen clothes lined with sheepskin, cloth caps with fur peaks, earpieces and serge gloves. The boots supplied were high-quality felt boots that took to the knee, beautifully warm and proof against frostbite, even at minus 35 degrees. Though, of course, the care of the wounded was the primary objective of the nurses, shops and furs appear to have caught the eye of the nurses. Nurse Hartigan describes on arrival the fur-clothed Russians, the fur shops and the reindeer trotting along the riverfront, drawing big sleighs driven by fur-coated Laplanders. Based on a photograph taken of the medical staff, taken on the frozen ice adjacent to the ship, it appears the ladies were not long in taking to the shops and acquiring some furs for themselves. 8 months were spent in Archangel before a return home in June 1919, with new experiences and new additions to their wardrobe.